could you give us like sort of an overview of the developments when it comes to the healthcare sector, given the ongoing bombardment of the Israeli army to much of the country in general? What has happened to the healthcare sector now?
Now the healthcare sector is in danger for sure, with the more and more escalations. We have lots of healthcare facilities and hospitals that are out of order now. 5 hospitals in the south stopped working. Other hospitals also in Beirut suburbs and other areas being targeted also are only operating as emergency operations. Lots of other units stopped working. Healthcare workers are sometimes not leaving the hospitals because there is danger for the transportation, so they are also at risk. Other healthcare related professionals like ambulance and other rescuers also are in danger, and they are being targeted. So we are at risk for sure.
Which kind of brings me to the next question, Dr. Abir. Given the situation that the medical staff are going through, specifically emergency services, how can they perform their jobs under such high pressure, and how do they deal with the influx of injuries coming in from these bombardments?
Actually, as you mentioned, we have lots of civilians who evacuated their place of residence now. And we have also lots of casualties after each airstrike. So we have a lot of patients that are being given the first aid only in some of the hospitals, also in areas that are hot areas, as we say. And then we are coordinating with all the ambulance services to transfer them to other hospitals in a safer, more or less, area. Yes, we don't have to forget that these hospitals are also overwhelmed now with the number of casualties, and we are in need to give them more nurses. At the order, we are trying to also support them with more nurses. Yes. And also you need more doctors and other healthcare.
Have there been volunteer doctors coming in from other countries to help out with the situation in hospitals across Lebanon?
Till now, we have enough resources. We are mobilizing our resources from one area to another, from the danger zone to a more safer zone, and this is why we are able to support each other. Some doctors, yes, contacted the order of physicians, and they are coordinating with the Ministry of Public Health and the order of physicians in case also they are going to join. Some specialized doctors stay in certain specialties based on the number of casualties and the type of injury and trauma we have.
Yes. Since you've mentioned like injuries and number of casualties and stuff, could you sort of describe an average day for a healthcare worker? What kind of injuries do these healthcare workers see on a daily basis across Lebanon?
We have lots of burns. We have amputations. We have severe bleeding and lots of cases with brain injuries, critical cases, fractures, all types of severe injuries. Sometimes we have ophthalmo, but we have a lot of burns, as I want to re-stress. And in Lebanon, we don't have a lot of beds to treat the burn patients.
Well, hopefully there will be ways to handle the situation on the ground. But could I ask you about the displaced people, since you've also mentioned this? Is Lebanon seeing the same kind of displacement that we've seen in Gaza, where the displaced are seeking shelter within medical facilities because they feel it's safer to seek shelter in these medical facilities?
We hope that they are staying in another area that's more safe. We hope so. We are trying to give them the medical care they need also in the shelters, and we hope they will still safe. They will be safe in that area.